Give it like 1 or 2. Oh, I'm sorry. We're just going to give it 1 or 2 more minutes as people start on popping in. I think if anyone could answer in the Q&A what their definition of burnout is, that would be great just to get things started. We're going to try to make this as interactive as possible.
Hi, Highland. We'll try to enable the chat. Give me just a second. Thank you.
Is the Q&A enabled? If anyone can answer in the Q&A what their definition of burnout is, that would be great as we wait for a couple more people to pop on in. Thank you for testing the Q&A for us. That's great. It helps anxiety on all of us. I'll give it 1 or 2 more minutes, just probably start about 5 after.
While we're waiting, we're just going to go through some housekeeping. For the intent and purpose of this talk and this webinar, we're going to, instead of using chat, we'll be using the Q&A portion of Zoom, and we'll be monitoring your questions as they come in.
All right, I think I'm going to introduce Dr. Kirsting briefly, and then we'll jump over to the questions in the chat. Dr. Kirsting, if that sounds great to you. I am Jenny Merrill. Melissa Fay and I are part of the Advanced Practice Providing Committee at SSAT, and we are excited to welcome you to this webinar on burnout. If there's any advanced practice providers that would like to get more involved with SSAT, please reach out to one of us or Bev, the association manager on the webinar. There will be times during the webinar that will be interactive, so please use the Q&A function for any questions or comments during the interactive parts and throughout the webinar. I'm very excited to introduce Dr. Kirsting. Dr. Kirsting is a clinical health psychologist who works exclusively with surgical oncology patients at the Medical College of Wisconsin. She got her bachelor's degree at the University of Wisconsin-Madison and completed her PhD in counseling psychology at Virginia Commonwealth University in Richmond, Virginia. She completed a postdoctoral fellowship in integrated care and behavioral health at the Dayton VA Medical Center and joined the faculty of the Medical College of Wisconsin in 2016. Her work focuses on coping with difficult experiences like being diagnosed and treated for cancer and on recovery following major surgery for cancer.
All right. Thank you very much, Jenny. And thanks so much for having me. We're going to talk about burnout today. And my first question for the group, oops, there we go. So we're going to talk about burnout and its impact, get some definitions, and talk a little bit about what the research shows in terms of impact. We'll talk a little bit about what can help reduce burnout generally. That's a long list. We'll talk a bit about the neurobiology of stress and then flow from there into strategies for managing your own burnout symptoms. So what is burnout? We've got a few answers on the chat. Thank you for that. When I question to myself, why do I drive so far every day? That's a great one. And when you feel physically and mentally, it's affecting your ability to work. Those are great. Yeah. So let me give you the typical definition. It is a combination of three things: emotional exhaustion, and that's the fatigue that comes from caring too much for too long; depersonalization, a depletion of empathy, caring, and compassion; and then a reduced sense of accomplishment, a sense of futility, that nothing you do makes any difference and that the drive is no longer worth it. And burnout always exists in a context. So we can have burnout with parenting, burnout with interpersonal relationships, burnout with schoolwork, burnout with homemaking, and burnout in the workplace. And today I'll focus mainly on burnout in the workplace, but everything I'm talking about really does apply to all the other domains. So what does burnout look like and feel like? We have a definition, but what does that mean? It means fatigue, irritability, difficulty concentrating, cynicism, physical ailments show up. And I think especially tight muscles, upset stomach, and definitely decreased job satisfaction. And factors that add to burnout in healthcare, and we could come up with a lot of them, but here are a few: understaffing, budget constraints, lack of control in your environment, cultural conflicts, and that can come up in a whole bunch of different ways, compassion fatigue, taking care of other people all the time, moral distress when you see something not go quite right in the environment, vicarious trauma, people coming in with terrible experiences, social pressures and expectations, administrative burdens, lack of support, and the overall workload. So we've got a lot of pieces here that can add to the overall feeling of burnout. And here's the impact of burnout in healthcare. We see an increase in compassion fatigue, is what the research shows, an increase in workplace turnover, lower quality of care for patients, decreased patient satisfaction, and increased rates of medical errors. So those are the big ones. These are a big deal, right? These are the things we think about and talk about every day. And the research shows that they're genuinely impacted by burnout. And we know that before COVID, research was showing that 54% of physicians and 52% of nurses had symptoms of burnout or were experiencing burnout. And following the pandemic, the physicians stayed stable, which is interesting, but the nurses are reporting even higher levels. It didn't break it down into other types of providers, but it can kind of make sense that nurses are experiencing even more burnout and stress. So what can be done? Lots. And most of it isn't your responsibility and is not what I'm going to ask you to think about and do in this particular webinar. So I have the link here to the Health and Human Services page on burnout. And they do a really good job of listing all the groups that should be involved: your employer, your government, your community, the systems that design our workspaces. All of those things contribute to burnout. There are absolutely, there could be a whole nother webinar. There are whole academic courses on how institutions are responsible for helping people to manage burnout. And one thing I like about this website is they actually list all of those way before they even get to any kind of individual level interventions for burnout. So burnout is a phenomenon that happens in a context. And the interventions, if we think about it broadly, are absolutely going to need to start in the forest level. Individuals are not responsible per se for managing burnout. But there are some approaches. So I'm a therapist. I work with patients who are going through cancer treatment. And what I'm gonna do is actually talk through some of the things that cause burnout and some of the ways to address it that that I would talk with a patient about in the same way. But we're going to apply that more broadly and to the work context. So first off, I'm going to take a neurobiological approach. So this asks us to think about how emotions work in our minds and our bodies. Emotions are cycles that happen in your whole body. They're neurological events that occur in your mind and your body. They're involuntary neurological responses with a beginning, middle, and an end. And that is important. So something kicks off this experience, your body and your mind react to it, and then something eventually has to resolve. That's how we flow through emotions. And by the way, I have the book here that kind of laid out a lot of the thinking that I'm going to describe. It's not unfamiliar being a psychologist, but there's a lot of great stuff there, and they have some of the metaphors are from there. So first off, emotions are tunnels. We go through them. You experience an emotion like sadness or happiness, and you start to move through it. And it is true that there is no way out but through. You have to go through it. And you can kind of think of it like this. So you experience a stressor, and then your mind and body have a reaction. And you can kind of think about mind and body like they're having a conversation with each other. Your mind experiences the stressor and it sends a message to your body to be nervous, right? And then that experience of discomfort, nervousness in your body sends another message up to your mind to stay nervous. And it ends up being kind of a cycle. So you have that mind and body reaction. And then eventually the stimuli, the stressor, wraps up, and you don't really necessarily have an immediate reason to be stressed. And then eventually we need to find a way for the mind and body to reset, to work through that emotional experience. So what happens when you get stuck in these emotions? When you don't have an opportunity to complete the cycle, to work your way through it, to do what you need to do to calm your mind and your body. You get stuck in the tunnel. I should mention I have a 5-year-old boy, so Thomas was very familiar to me. Yeah. And let's talk, I also really like hippos. So we're going to talk a little bit about hippos. So you can imagine that you've got a hippopotamus chasing you. Interesting fact about hippopotamuses, they actually are the fastest land mammal, although they can only sprint. So if you were to run away from the hippopotamus, you've got a good chance because they really can't go very far. So imagine your mind and body have gone into the stress experience of running away from a hippopotamus. You are in flight, in the fight or flight combination. Hopefully you're not in freeze. That would be bad. Hopefully we're in flight and we're running. And we hopefully get away from the hippo. But I did want to reinforce just how scary hippos are. So this is helpful, I think. But they're also very cute. So you had to complete the cycle on hippos as well. So let's say you finish that run. You finish the run and you get away from the hippo. You're going to have a moment where you want to get a high five from your friends. You maybe want to have somebody open a door and pull you inside so you know you're safe and to give you a big hug. These are the things that are going to help you calm back down, bring your nervous system back down to normal place. Because even though you've gotten away from the hippo and your brain knows that, your body hasn't really figured out how to be sure of it in any way. So you need other experiences where you're able to be calm and still and figure out that your body is actually safe after a scary experience. Possibly looking at baby hippos might do it because they are actually very sweet and cute. All right, so how does this play out in the healthcare environment? And I'm gonna give you an example, but I would love to hear other examples. If anybody wants to speak up, that would be fine, but or just answer in the Q&A. So essentially the question is, how do you see this cycle playing out in the healthcare environment? So I've got an example. You deliver difficult news to a patient and they have a really strong reaction. And no matter how many times you've done this, this is a very stressful experience. Being the one to tell them, being the initial person to hold their distress. And you experience that emotional distress, sadness, and worry. You might think you don't because we're so trained to kind of tolerate it, but you do. You experience that distress. It's part of your day. And your neurobiological response is your cortisol rises, your muscles tense. All of that can happen in that circumstance. Alternately, you might be kind of frozen too. If that's how you handle the stress of an interaction like that, you might be just totally shut down. And that is a physical experience as well. So you wrap up the encounter with the patient, you leave the room, and you're immediately headed to the next patient or to chart or whatever. So in this experience, there was no opportunity for your body to return to baseline. You've not had a chance to do anything that would bring your cortisol levels down, that would slow your breathing, that would bring you back to a normal state. Essentially, you're the train stuck in the tunnel. It's a small amount of stress potentially. This is like the incidental stress of the day. But when you're not completing that cycle over and over again, it accumulates. So I wonder if there's other examples of how that might play out in the healthcare environment. I'm going to look over at the chat a little bit.
Well, I know I can speak for an example from myself where last week I had a patient that we were discussing hospice, and the family was prepared for this, or so I was told, and I believe my team, that they were prepared for this conversation. But when I went in to have the conversation, they had such a strong reaction that it made me second guess myself. And immediately I could feel my heart rate increase, and I got a little nervous because I thought to myself, am I missing something? Did I miss something?
Yeah.
Could we potentially offer something? Or was there another discussion that was had that maybe I wasn't aware of before I walked into the patient room? And I didn't miss anything. It was a appropriate patient, appropriate conversation, but it really made me very uncomfortable. I couldn't get settled for the entire conversation as much as I tried to calm myself and try to have as genuine of a conversation as I possibly could.
Yeah. How do you think that impacted the rest of your day?
I was towards the end of my day, and I left very uncomfortable, and I was sort of off the rest of the day until I saw my team again the following day.
Yeah.
And kind of explained. I was kind of taken off guard by the strong reactions from the family, and sort of I think really more consoled that I didn't miss something, that I didn't miss a conversation, that there wasn't a misunderstanding. And then everyone sort of said, yes, we had the same experiences. But it wasn't until the next morning when I was rounding with the team that I could really kind of take a deep breath and recenter myself, and reassure myself that I wasn't making some, horrible mistake.
And I can also hear that both mentally and physically, it was like there was a residue of it sitting on you all the way to the next morning. You were feeling it still.
Yes.
Yeah.
It just didn't set well. And it just
Gotcha.
kind of threw me off the rest of the evening as I went through the conversation over and over again in my head.
Yeah. Yeah. Okay. Other ways this plays out? Just one other that comes to mind is all the rushing we do all day to get things done. That's a form of stress as well. That's a little bit like being chased like by a hippo. You certainly are trying to speed through things and do it as perfectly as possible. Yeah. And when you get to the end of that, you hop in your car and maybe you start honking at people. Like it doesn't go away. It's not done until you figure out a way to move through it emotionally. Okay. So Just a note on healthcare culture. I think that the culture around healthcare often fails to make space for people to complete emotional cycles effectively. And what happens when you stay activated for hours a day, every day? Well, we all know that that's going to have a cardiovascular impact over time. It's going to probably cause maybe interpersonal problems at home. It could cause stomach problems, all kinds of different things can come into focus physically when you're activated for hours a day like that. And this is also where burnout comes in. Your body becomes accustomed to this level of stress and operating at that level of stress and doesn't expect anything else. And you end up kind of stuck there. So how do we complete the cycle? So now I'm going to go through some strategies around this, but essentially all of them relate to telling your body you're safe, getting your system to sort of calm down, and experiencing connection with other people. So in a psychological sense, you kind of turn towards the feelings with awareness, non-judgment, and compassion. They're there, they're real, they deserve to be attended to. And a psychologist or a therapist would have you talk through your experiences, and that would be a way of turning towards these feelings and experiencing them and kind of working through that process. And so that can be something you do with friends and family by talking about it, but it also can be something you do in therapy. So here's a plug for therapy, and the rest of it will be other options. So exercise, of course, exercise reduces stress and helps us manage burnout. And if you Google up a list of ways to manage burnout, this will always show up at the top. But I think it's really important to remember that exercise is maybe not exactly the right word anymore, because when we say exercise, we see Peloton, right? And it doesn't have to be that. It really is just changing the way your body feels intentionally, in some intentional way. So walking works, dancing works, standing up from your desk and tensing every muscle in your body and then letting go, even softening your jaw. This all counts as exercise, movement that changes how you feel. Softening my jaw is my tried and true one. That will always work for me to kind of take my level of activation down at least a little bit. That one always works. I pretty much need to be reminded to do it, on a regular basis. Breathing. So again, breathing's going to be on that list. Relaxation breathing. So what does this breathing actually do? I like to come back to the hippo example, and we think about you've been, chased by a hippo and your breathing got fast. If you get to a point where your breathing is slow or you're out somewhere and you're able to breathe slowly, it's a way that you actually use your body to tell your brain that you're safe. So slow breathing is using your body as a tool to help your mind know that there isn't a hippo chasing you. And I know that sounds kind of counterintuitive, like you have to think the thought to tell your body to do the breathing, to tell your mind that it's safe. But, we are not really able, it's kind of like if someone were to tell you to stop worrying, it's not that easy. You have to involve your body in the process to get the activation to come down. So slow breath in, but especially a super slow, long breath out is shown to be really effective. 1 to 2 minutes is enough. And I really mean that. In fact, I ask my patients to do 1 to 2 minutes of breathing a couple times a day, because then it develops as a skill. And you have that skill in your back pocket so that when you're activated and when you're feeling really stressed, you just kind of swoop in. Your body knows that it needs that breathing and it becomes a really accessible habit. So this doesn't have to be sitting on a pillow in lotus position for 20 minutes. It never has to be that. It can be 1 to 2 minutes. And yes, your thoughts will run amok while you do this, and that's okay. You're not doing it wrong. That means that you're working through things. So when that happens, you just return to your breath. It's interesting. I was reading that the 2 groups that pay the most attention to breathing are yoga instructors and Navy SEALs, because those Navy SEALs really have to manage their activation to be able to survive. So positive social interactions. So like I said before, getting a hug and an atta girl after getting away from the hippo is going to immediately help to bring your physical activation down. And connection makes your mind and your body feel safe. If you're with people that you trust and who understand you, it is much, much more straightforward to get back down to a base level of activation. So I wish for everyone and myself that we all have coworkers that help us do this. And anything that can be paid attention to on teams to help this be possible, to help people on your teams have someone for whom they would be able to bring their activation down after a difficult situation, that is an incredible asset in a workplace. Laughter. And I'm not just talking about kind of social laughter that we do to smooth interactions, but thinking about deep guffaws that make you feel connected to other people and alive. If I'm really stressed out, I listen to John Mulaney because he always makes me laugh hard. And I think it's useful to have some go-to like that will kind of grab you and help you to engage that particular relaxation response. Affection. There's research that shows that a 20-second hug brings you back down to a baseline level of activation. You'd also think of cuddling with a child when you think about this. Now, 20-second hug is not practical in the workplace necessarily, but it's something that you could intentionally do with a partner or a sibling or a friend under the right circumstances. Crying. This poor hippo is crying now because I got away from it. Crying is a really interesting way to down-regulate your body. And the way that therapists kind of try to help people use crying as a tool is to not focus on the stimulus, the thing that's making them cry, but actually to focus in on the physical sensation of losing control and having that strong emotional response. Crying usually resolves in a few minutes. People no longer even feel like crying. They don't have the urge anymore after a few minutes. And it often downregulates your body to be back in a place where you can cope. Creative expression. And this is my personal example that I always like to give. When I was in grad school, dissertation was not going well. I was burned out and it was not looking like it was going to be done. And on a whim, I started a vintage water ballet team. And it changed everything. Suddenly my life was much happier and my dissertation got done, which at that point I was not sure. So creative expression, finding an outlet that allows you to be a full person in a way that's very, very different from whatever's causing the burnout can be an absolutely wonderful way to cope with that chronic stress. And then reconnecting to values. Actually, I kind of just put a short list of things that I think healthcare providers often find as their core values: helping others, connection, science, social justice. And I think in the hubbub and stress of your work, people tend to lose track of these. You're not thinking about how much you value being able to help someone through their cancer experience, how much that is important to you personally when you're doing it all day. How could you? But if you can bring back into mindful awareness that value of yours, whether that's putting a Post-it note up or turning it into a mantra that you say before you walk into a room, having a sense of connection to your values helps you to stay grounded in your body because your body feels safe because it's doing the thing that it intends to do and feels comfortable doing. So with all of this, working on issues around burnout is never going to be a process that completes, that finishes. You're never going to be done with burnout or done with stress. But noticing if you've been able to move yourself from a 7 on a stress scale to a 5 can make a big, big difference. And then if you're able to do that regularly, this is the kind of thing that helps you to manage burnout on a regular basis. So again, what we don't want is to be stuck in the tunnel all the time. We can't survive if we're stuck in the tunnel, not processing through our emotions, not getting our bodies returned back to normal. But we're able to do the stressful work that we do if we have a way, if we have a lifestyle that allows us to get back to that level. And noticing it also makes a big difference. And that's where I'm going to stop for today and take some questions, I hope.
You touched on some really good techniques that we can all use, not only in the workforce, but even in our daily life. What are some of the cultural influences that come into play with managing stress?
Oh, so that's a great question. And I think really important to think about. I think there's certainly pressure on people in the healthcare environment to not be openly emotional, to not wear their emotions on their sleeve, to be under control at all times. And I'm not sure that that social expectation is always helpful to us. We are, we're working in life and death situations, in very difficult situations, and to expect people to never show how their emotions around this seems pretty unreasonable, but it is very much built into the culture and functioning of the healthcare system. So I think there's kind of a fundamental cultural problem there. And then I think that is even more so on women who are expected to behave as caregivers much of the time, and not necessarily shown how to refill their own cup when they become exhausted from that emotional fatigue.
We got one question, and then we got one question that I'm going to read off the chat right away is how to set boundaries at work, no matter how the environment is, when you should consider to quit. Ooh, that's a deep question.
That is a big question. So there's personal pieces to that, and it's going to be different for every individual. I think maybe, it comes down to one of those things that I mentioned before, which is a lack of control. If you feel hopeless about your ability to impact change in the work environment, that might be an indication that you can't be there. But you started the question with how to set boundaries. And the thing about boundaries is boundaries are never intended to change other people's behavior. And that's a really important way to think about it at the start. So boundaries are intended to provide for you the circumstances that you need to be okay. So I need to not work and not be contacted after 6 p.m., for example. That could be a boundary that you set. And that is not intended to change other people's behaviors, though it may need to, but it is intended to protect you. And that has to be where boundaries start from, start from a place of the impact of them has to be to make you feel safer and more comfortable all the time. So with that mindset, I think boundaries are difficult, and you have to decide if you're going to make exceptions to them. You're going to have to decide how does it feel if you make one exception but not another. There's a lot of complicated issues that go into working on boundaries. So this is where I would absolutely make a plug for therapy. I think that's the kind of question that 1 or 2 conversations with a therapist can really help you to shore up the individual details and focus in again on your values, what you need to survive, and what are absolute no-goes for you. I hope that answers the question.
And when we talk about these baby steps, for example, from the slide where we're moving the stress from a 7 on the scale to a 5, but we're never really fully recovering to a baseline. How do we psychologically, how do we emotionally, and even physically, how can we bring ourselves back to more of a steady state? Because I think when I think of 5, I still think that's sort of 50%, or that's still sort of at a moderate burnout level. What
Yeah,
steps or what can we do to help bring us back to a calmer state?
that's a good question. Um, so, in a sense, acceptance is a word that comes into play here. And if you make an effort to accept that your workplace is stressful, for example, and choose that you're not going to react to it in the ways that you have in the past, that might be a way to make a fundamental change. And what I mean by that is rather than, it's kind of hard to describe, but rather than fighting the stress sort of internally, you kind of expect it as part of your workday, as a task, and not as something that changes who you are or impacts your identity. And then you make choices around how much you can tolerate. Um, but, so the question of how do you get down to a 1 or 2 on a burnout scale, I think probably will involve some vacation time. If you've been at a 5 for a long time, like you have to step away and do some practical things like that. If you're super burned out, you might need that job change. You might need to take a leave of absence. You might need to switch to a different schedule for a period of time. And I think those are all questions that we fear asking, but are really important to ask at certain points in our lives. And everyone ends up asking them one way or another. And sometimes it's better to consider doing that before you're completely burnt out, and to think about doing that sooner. That's a hard question. And I think especially given the cultural implications I talked about before related to healthcare.
I have a question. For those that might be in a supervisor role, and maybe oversee whether it's peers or trainees, what kind of advice would you give them to have that pulse on whether whom they're overseeing are getting burnt out? What kind of maybe check-ins, timeframes, or what kind of language would you use to assess those kinds of things? Because you're checking on your group, and
Yeah.
medicine is very much a team sport. And I feel very strongly that we all have to work together to really work efficiently. What kind of suggestions would you give them?
Well, I think one there would be one of the ways you want to know the people that you supervise would be to have an understanding of what they do to downregulate. What do they do on the weekends? How does it work? How do they manage to bring down their activation when they leave work? What do they do? So having a sense of what it is that already works for them, and a little bit of awareness about whether or not it's happening. I think that can feel really personal, maybe too personal for some people, but I think it's really an appropriate level of knowledge to know how someone is coping with a difficult job. We all know our jobs are difficult and stressful. So knowing that the people you supervise have a way seems like a valid responsibility of a supervisor. And so in terms of language, I would, that is a casual conversation. Help me understand, how you blow off steam on the weekends. Maybe that's an interview conversation. I don't know. But to have that kind of personal understanding would be important. And then to check in and make sure it's happening. What have you done in the last 2 weeks to help you manage this? And another piece of that puzzle, I think, would be modeling that it's appropriate to talk about stress in the workplace, and modeling your own attempts to downregulate and manage your stress. So for example, you have a very difficult interaction with a patient. You say to the workroom, I need a walk. So I will be back in 7 minutes. And then you go do it. But that would, I think, be incredibly helpful way to demonstrate that it's appropriate to take care of yourself, even if it means stepping away.
We have another question. What should you do when burnout affects your ability to treat patients, to perform surgery, despite you having vacations a couple months ago?
Oh, that's a tough question too, because it baked into that question are safety issues, right? And so it sounds like maybe I'll answer the question more like if you doubt your abilities. So if you find yourself questioning, I think therapy would be a really important step there. As well as kind of the things I mentioned before about how you would evaluate if you need a big change or not. So if you've had the vacation time, if you've kind of worked with a therapist and are trying to figure out how to keep down regulate and manage your stress in the work environment, and it's still not getting to a better level, I think that's a point where you ask some hard questions. So I'm not quite sure how to answer beyond that, because it's so individual again. But it comes back to the culture piece. Is it safe to your career to be able to put your hand up and say, I am not doing well? And I think if we can create a culture where it is safe, it's normal to have that happen to you in your career, and for you to need support, I think that would be a cultural improvement that would change the nature of the question itself. I will say that therapists are really well equipped. Psychologists are really well equipped to help people deal with these particular issues. And EAPs exist for a reason. I think almost nobody uses them. It's so the levels are really low, but that exists for a reason. And those people are good at getting you hooked up to the right therapist, which is really the hardest part. And when you're burned out, the stress of finding a therapist, that alone is a huge barrier. And then, God forbid, the possibility of starting up with a therapist and it not being a match, which happens. It's a little like online dating. You can dial up all the right heights and weights and it can still not be the right person. So having something either an EAP or a friend or a relative to support you through the process of getting to a therapist, I think is really important. To say to someone, you should try therapy and then walk away, it's not very helpful. It's a hard process to get that started. I wish I had a better answer, like talk to Harry Potter or something. Yeah. All right. Those are some really good questions, really hard questions. Thank you.
Thank you so much for taking the time and really bringing this perspective to us. I think burnout, at least for me personally, is not a new concept, but the perspective that you brought to us today certainly is helpful, and I will definitely be taking some of those techniques and not only implementing them myself, but also sharing them with, my office mates, my coworkers, whom, sometimes while I might not be going through the same level of burnout, I see it. And it's a very visceral emotion. And sometimes that gets projected onto me, or you take it home. And so being able to share some of the techniques that you've taught us today, I think will be really helpful moving forward. And I especially liked your point about keeping in mind what your values and letting that sort of guide what your next question or what your next step might be, and addressing these very kind of difficult questions that we have to ask ourselves. So I really appreciate that perspective.
Thank you so much. And thanks for having me. Yeah.
Yeah, thank you so much for coming. Not myself, but my daughter has some little motivational posts that she has on outside walking out her room. And I'm like, oh, Eleanor, I don't know where you learned this, but I love this because she hasn't learned it from me. But I was like, this is something that we all can do in our day-to-day life.
It's so easy to lose track of. Yeah.
When we're talking about burnout and some of the strategies and the coping mechanisms that you us, is the word emotional intelligence came to mind. Is this sort of something that we're learning, like we're sort of improving our emotional intelligence, that these skills are helping us move through?
Absolutely. So Another word that's on, in that list would be mindfulness, right? And when people say mindfulness, it gets thrown around a lot, but mindfulness is the ability to know what you're feeling when you're feeling it, to be aware of it, and to be able to make choices about how you deal with it. And I think emotional intelligence is similar. I think emotional intelligence also involves a component around other people and understanding what they're feeling and how it's impacting their behavior. But that concept, mindfulness sounds really complicated. There's whole courses you can take in mindfulness, but it's really cultivating an awareness of how you feel when you feel it. And that fits really well with what we talked about with going through the tunnel. If you're not aware that your body is under stress or that your mind is under stress, you can't do anything about it. So yes, cultivating mindfulness, emotional intelligence, just psychological knowledge about how this all works are all pieces of the puzzle of being able to cope with it.
Well, thank you. I think this was extremely helpful on many, many levels. And I echo Melissa when I say that I will be utilizing some of these skills that you've shared with us, and also with some of my teammates as well, as we support each other, and sometimes very demanding jobs.
Yeah.
So.
Yeah, I'm glad. I'm glad.
Are there any other questions?
Thank you again so
Yeah,
much. We
pleasure.
truly
Yeah.
appreciate your time. And for those who are still in the call, if you work with or know of any APPs, please send them our way. We are quite the active group that we want to continue growing and sharing with our careers and our journeys as we navigate this sometimes complex uh, group in our work lives. And so please send them our way. And we very much appreciate everyone's time today.